My name's Gilbertson. I am an Associate Nurse Unit Manager at Wodonga Theatres for Albury Wodonga Health. My clinical background, I've been a registered nurse for 10 years now. I've completed in that time a graduate certificate and a graduate diploma in nursing, and currently working on a Masters by Research project. I believe that all clinicians, regardless of nursing or medical or allied health, any areas, should all be involved in research. It's something that we need to do, and to increase our level of knowledge and understanding, we should be constantly looking at what we're doing and reflecting and seeing if there's new evidence and new ways of actually doing things so that we provide the best possible care for our patients. The name of my project is a feasibility study examining the use of virtual reality as a non-pharmacological intervention in adult patients with needle phobia. What my research is trying to do is to reduce that level of fear and anxiety that the patient experiences by distracting them from the actual stimulus of a needle. So what we do is we're distracting them by the use of this virtual reality environment, which is sound and sight, completely three-dimensional, 360-degree view of a beautiful panorama that they choose, and then they can still hear instructions from the healthcare provider or clinician that's going to cannulate them, but it reduces a lot of the fear and anxiety that they experience. The participants that we're trying to recruit for this project are anybody aged 18 years or over who have needle phobia. So the virtual reality, the actual study that we're doing is we take a set of normal observations, which the patients would have normally, and then they get their standard level of care plus the virtual reality intervention. The virtual reality headset's a small silver box, which is about 500 grams, and it just slides over the patient's head, and there's speakers in there and some glasses, and it shows them a three-dimensional environment. And that's all they have to do. At the end of the study, they just let me know how they felt, how that went, and I asked them some questions in a semi-structured interview. With this research project, I am the site contact person and the person that's actually undertaking the research. As a master's candidate, I'm under a supervisory team. Dr. Raskipper from Trobe University for the John Richards Centre for Rural Ageing Research is my principal supervisor, and he's the principal investigator for this study. Professor Irene Blackberry, who is the director of the John Richards Centre for Rural Ageing Research, is my other supervisor, and she's another point of contact for the study. As a clinician, research means increasing the level of knowledge and understanding that we have of different aspects of our environment and different aspects of the care that we provide to our patients. To make things easier, make things more efficient and safer. That's critical for a modern healthcare system. What we hope to find from the study is that virtual reality is a feasible method of distracting an adult patient, or a non-pharmacological method of distraction or intervention for needle phobia, to reduce their level of anxiety and to increase their satisfaction.